In this time in history, it is absolutely critical that we have a two-way conversation, that the workforce has continual opportunities to give feedback and to share what they need, what would help. I encourage you to identify where in your work could you take back some control. I walked out the doors of the emergency room of a large trauma hospital. I had just worked a 36-hour shift in the cardiac care unit of that ER, admitting critically ill patient one after the other after the other. I had no idea how I was going to make it through the rest of the week, much less the years that remained in my emergency medicine training program, not to mention decades as an emergency physician. I'd been diagnosed with depression at that point, and it wasn't until years later that I came to appreciate that actually my primary diagnosis probably was severe burnout. I started to contemplate quitting the ER, and then I started to think about quitting medicine entirely. And then my thoughts got even darker. And I started to think about how I might be able to actually just quit the planet that night. And at the very moment that I started to have those thoughts, the phone rang. In the past, you might have felt really good about your ability to do your job. You may have felt before that you were a really good fit. But lately, you started to question it. What are some of the things that are in place that just aren't working, that make your jobs harder, that you would be so happy if we took away? There's a pre-pandemic study from EY that showed that just the very simple act of checking in on someone, if you're that person who gets checked in on, not only does that make you feel significantly more connected to your organization, but it also significantly enhances your sense of belonging. And for humans, our sense of belonging is so profoundly important for our overall resilience. I've been executive coaching for quite a while now, and a lot of people come to me because of my story, because they want help quitting their jobs or transitioning to a new career entirely. Most people that come to me are actually just severely burned out. And when we work on initiating changes in their workplace and changing how they relate to their work, their boundaries, how they think about work, and how they take care of themselves, I'm still amazed every time. The majority of the people that I work with end up not quitting their jobs. It was the burnout that was making them feel that way. We need to think about it at three different levels: the larger organizational level, a team level, and then we look at the individual level. Now, it's important to point out that burnout is not a disease. It is also not a formally diagnosable mental illness or mental health disorder. Rather, it is a clinical syndrome. For burnout to be present, there has to be chronic work-related stress. But to really move the needle on this and to create a big change in terms of the numbers of burnout we're seeing, we have to look at it primarily actually at the organizational and team levels. I embarked on this adventure, first of all, wanting to learn everything that I could about big picture, whole human mental health and resilience for myself, so I would never, if at all possible, end up in that same place again. And then the more that I learned, the more that I decided that I wanted to make it my entire life's work to help as many people as possible not end up where I did. We absolutely must together commit to removing the stigma and shifting the culture around mental health, to make it okay, to not be okay, because quite frankly, most of us are not okay. Everyone in this room has a role to play as we move forward. We are all in this together, and we will do this together. Thank you so much.